Action League, or HEAL. We are so proud to stand alongside Senator Markey and Congresswoman Barragan and our partners today to shine a light on a simple truth. Climate change is a public health crisis. Now, I don't have to tell you that it's hot outside or that global warming is a concern. We're all worried about our children, our elders, and our neighbors when temperatures soar like this. I come to this work after years as a city planner and working in local government, meeting with school principals, parents, and community leaders who had no choice but to cancel recess because the air was too polluted to breathe safely, or to stay indoors simply, trapped in heat because high temperatures were correlated with increased crime. Immediately, my own childhood memories of catching fireflies at dusk or running under sprinklers, chasing the ice cream truck, were put into stark perspective. Just one zip code away from mine told a very different story. Because climate change isn't just about melting ice caps, it's about whether our kids can play outside safely or whether our grandparents can leave home without risking their own health. We cannot let our zip codes decide who gets clean air, drinks safe water, and has a healthy environment to grow up in, and who is forced to stay inside simply to stay alive. That's why we launched HEAL, the Health Equity and Environment Action League, to unite health professionals, environmental justice advocates, and frontline leaders to tackle these interconnected threats. Because pollution, flooding, wildfires, toxic water aren't abstract issues. They're emergency room visits, chronic disease, and lost lives. I wanted to end by saying thank you to Senator Markey, Congresswoman Barragan, and all the champions here for recognizing that protecting public health and tackling climate change are inseparable. We look forward to working together to turn these bills into action and to build a healthier, more just future for all. So without further ado, I will turn it over to the Congresswoman from the great state of California. Thanks so much.
Well, good afternoon. I'm Congressmember Nanette Barragan, representing California's 44th District. My district includes the Port of Los Angeles and South LA. My district is surrounded by 3 freeways and the port. It is at the center of being a frontline community where people are experiencing air pollution and impacts directly from climate change, directly from pollution. And it's among one reason why it's so important that we share the stories and that we recognize as a Congress that climate change is a public health crisis. Now, my district, we don't say climate change very much. We talk about the health impacts because that is how most of my Latino community can relate. It's when you talk about the health of their kids, when you talk about the asthma, or when you walk around my district and you see kids at parks with inhalers around their necks, just waiting to use their inhaler. That should be enough for all of us to stop and saying, this is wrong, and it shouldn't happen here in this district, and it shouldn't happen anywhere across this country. So the issue of climate change being a public health crisis is happening now. Not at some distant time, it is happening right now, and people are dying right now. While Donald Trump and his administration roll back the clock on progress and stick their heads in the sand, the real life consequences of climate change are all around us. People are dying from historic floods and extreme storms. Extreme heat is putting people in hospitals, and many urban neighborhoods have no trees or no shade or no air conditioning. It may feel like 110 degrees and families can't escape it. Just the other week in my district, I had a constituent from Carson, California, called my office concerned about the heat wave and how Trump's new big ugly law will raise electricity costs. And make no mistake, this bill is going to make your electricity costs go up. And the Trump administration is doing nothing about it, absolutely nothing to bring down cost. And they've made the largest cuts to Medicaid ever, taking away health care that helps people access things like asthma medications, cancer screenings, and emergency care. They shut down programs that protect people from extreme weather health risks, such as the Office of Climate Change and Health Equity. So just think about this. You're a maybe low-income family. You live in a frontline district where you might be seeing the impacts right away of climate change or air pollution. Now you lose your access to health care. You don't have Medicaid. You talk about a double whammy, it's happening now. And this administration wants to eliminate energy assistance that helps families keep the air conditioning on during heat waves. Make no mistake, Trump's policies are dangerous. They're dangerous for families, they're dangerous for health. And who pays the price? Our low-income and middle-class communities, our communities of colors, our outdoor workers. That's why I was proud to join Senator Markey in leading in the House to introduce a resolution that says loud and clear, climate change is making people sick. And we must act and invest in the tools that protect our public health. We'll continue to fight for affordable cost of living, including the ability to turn on your air conditioning when it's too hot. We're going to fight for things like clean air and water protections, and of course for access to health care for Medicaid, because this fight is not over. And now I'll hand it over to Leslie Fields from We Act for Environmental Justice. Thanks, Leslie, for all your work and all of our partners here today. Well, of course, hiding in the back over here was Senator Markey, so I didn't have a chance to see him, but a champion for climate, a champion for clean air, for clean water, a champion for somebody who's willing to stand and say, we are going to continue to fight for this, and a champion behind this Senate resolution, Senator Markey.
Wow, thank you. Wow. Thank you. Thanks to Congresswoman Barragan for her ongoing partnership and leadership in the fight for a livable future. And thanks to all the advocates who are here today, especially Leslie Fields from We Act, doing incredible work, turning the tide for a more just and healthy and equitable future. The climate crisis is here, and it is a 5-alarm fire. Extreme weather events, supercharged by the climate crisis, making headlines time and time and time again, and it's only going to get worse as year after year after year go by. And the greenhouse effect, with all these fossil fuels up there holding in the heat, lead to worse fires, worse floods, worse damage, a quickening of the melting of the ice covering in Greenland and the Arctic, that is going to cause catastrophic conditions on the planet. Earlier this month, the floods devastated Texas, New Mexico, North Carolina. These rising waters left tragic death and destruction, devastation in their wake. Children who lost their lives because of that flooding. In 2024, hurricane season was one of the deadliest Atlantic hurricane seasons ever, leaving devastation up and down the eastern seaboard. In California, out of season yet catastrophic wildfires killed dozens, displaced thousands of people, and sent toxic smoke throughout the West. And in late July, as the thermostat soars, so do the health risks of climate change. Extreme heat is the deadliest type of weather disaster, threatening Americans with heart attacks, stroke, exhaustion, heat stroke, death. It's here. It's worsening. So every day that the fossil fuel industry is allowed to send up more of these toxic, polluting fumes, there is a tax that all Americans have to pay, all American families. And that tax comes in the form of more asthmas. That tax comes in the form of more cancers. That tax comes in the form of more disease in American families. And on top of that, it's flooding, it's wildfires, It's disasters. And climate disasters don't just take a physical toll. Fleeing your home, seeing your loved ones hurt, or worrying that you're in harm's way, they also cause a massive toll on mental health. And it's not just big name disasters. Climate pollution also poisons the air, hurts our lungs, make our communities sicker. Yet Donald Trump and Congress, they have made a decision that they are going to, in fact, make it worse. They repealed the tax breaks for wind and solar. They repealed the tax breaks for batteries. They repealed the tax breaks for all electric vehicles. They repealed the protections that we were putting in place. The planet is running a fever. There are no emergency rooms for planets. We have to engage in preventative care, and the Republicans repealed the preventative care. And they simultaneously want to kill the budget for the Weather Service and for NOAA, the warning system that, oh my goodness, it's going to get worse because they repealed the wind and solar and all electric vehicle future. And then finally, they want to end FEMA, which is the ambulance coming to each one of these disasters that were preventable. So that's where we are. We have this incredible moment in world history where the science is clear, where we can act together, where we can come together to be the army of hope for the future. We are not giving up. We're not going away. We're knocked down. We're not knocked out. We're going to get up. We're going to fight and win. The Patriots 250 years ago, they got knocked down, but they weren't knocked out. The abolitionists, they were knocked down. They weren't knocked out. The same-sex marriage movement, they were knocked down. They weren't knocked out. The civil rights movement, they were knocked down. They weren't knocked out. They got up, they fought, and they won. And that's what we're going to do. We're going to get up. We're going to fight. We're going to win. Thank you all so much for everything you're doing to make this a winnable fight for the future. Thank you. Oh my goodness.
Thank you.
Oh my God, sorry.
It's my home senator there. Thank you all so much for being here, and thank you, Senator, and thank you, Representative Barragan, for your leadership in working with us to center environmental justice in the fight for policies that protect our communities. The ice caps are not the only one melting out here. So good afternoon. I'm Leslie Fields. I'm the Chief Federal Officer for WEAC for Environmental Justice. For almost 40 years, WEAC has been working to build healthy communities by ensuring that people of color and low-income residents participate meaningfully in the creation of sound and fair environmental health protection policies. WEAC has fought and won for policies that bring this mission to life, protecting the health and lives of our children, families, and communities. As we mark 30 years since Chicago's deadly heat wave this month, this fight is also deeply personal. My elderly uncle who lived there suffered from COPD, made much worse by that heat wave, and I have elderly parents and an aunt who are very vulnerable to these extreme weather events. And so now, in 2025, we are facing yet another summer season of historic heat waves that continue to cost lives. That is why WEAC is fighting to safeguard health and climate resilience in New York, New York's most heat-burdened neighborhoods, and advocate for improvements nationwide. In New York City, Black residents make up 50% of heat-related deaths, despite being only 25% of the population. To address this, we have pushed for increased funding for cooling centers, stronger worker protections, tenant cooling mandates. Through our 2024 Extreme Heat Policy Agenda, we also helped pass the city's first urban forest plan to ensure frontline communities benefit from tree cover and its life-saving impacts. Through our Healthy Homes First campaign, we advocate for policies and initiatives that address energy affordability and overlapping hazards, lead, mold, indoor air pollution, and extreme heat, to protect the health of low-income communities and people of color nationwide. Yet the Trump administration and their allies in Congress are actively dismantling essential programs that are solutions to these connected crises, including gutting the low-income home energy assistance program, LIHEAP, even though it is supported by 74% of voters nationwide and saves lives. WEAC and our partners demand a full restoration of LIHEAP funding and its staffing, which was all cut out. We will work to continue to ensure that our communities have the resources and health and climate protections that they deserve, because environmental justice is about dignity, health, and the right to thrive. Thank you so much. And I have now the great honor and pleasure of introducing the most excellent Insay Witherspoon, the Executive Director of Children's Environmental Health Network. Thank you.
Thank you, Leslie. It's an honor to be here. Again, I'm Insay Obot Witherspoon, and I'm currently serving as the Executive Director for the Children's Environmental Health Network for a good couple decades now, or CEHN. CEHN is committed to ensuring that the healthiest, safest, and the best futures for all children are only ahead of them. The future includes one that addresses and mitigates the health harms caused by climate change, and that is indisputable. As previous speakers have mentioned, you can't have a conversation on climate change without talking about its impact on health. Women, children, and in particular, children of color and those from communities that have been economically disenfranchised are especially vulnerable. Climate change exacerbates virtually every disparity experienced by a child from a disadvantaged community. We already know that children from Black, Latino, Latina, disenfranchised communities already experience higher rates of asthma and upper respiratory illnesses, among other chronic illnesses. Increasing temperatures caused by the climate change translates into more smog, poor air quality, and longer pollution seasons that also worsen asthma and upper respiratory symptoms. Most of the same neighborhoods that are also on the front line of climate disasters, these are all the same. They are more susceptible to dangerous heat waves, floods, wildfires, and other extreme weather events. That's why it's critical that the federal government treat the climate crisis as a true public health crisis. The acknowledgement would open up more funding options for the federal government to address the disparate impacts faced by communities, while promoting best practices across all parts of the federal government to safeguard our children, our families, and the communities that support them. Whether it's increasing funding for critical programs like LEHAP, or directing more Health and Human Services and Environmental Protection Agency funds to communities on the front lines of the climate crisis, the government can and must do so much more to tackle this urgent threat increasingly faced by communities all over the country. At a time when funding for climate and health programs have been cut, while also punishing scientists for doing their work and slashing the federal workforce, it is more than important now than ever that efforts like those supported by Senator Markey and Rep. Barragan get the attention that they so deserve. Climate change, our environment, and public health are linked. It's time for the federal government to make that connection for the protections of all current and future generations. Thank you, and I have the pleasure of also introducing Ashley Smith with a great partner, the Alliance of Nurses for Healthy Environments.
Thank you. Good afternoon, everyone. My name is Ashley Smith. I'm a public health nurse in Los Angeles, and I'm representing the Alliance of Nurses for Healthy Environments. I'm also a doctoral student and a mother. So let's get right to it. Congress must act now. We are living through climate chaos. We can't keep calling disasters once in a century, especially when they're happening every year. Sometimes they're happening every month. Fires are ripping through communities and leaving nothing behind. Floods are wiping out roads, homes, and our history. Heat waves are sending people to the emergency room because they do not have the luxury of air conditioning. This is not a future problem. We know this is already here. So I'm here today because I'm tired of watching policy move slower than the disasters we're facing. While frontline providers are doing everything we can to respond, essential safety nets are being weakened. We are seeing cuts to programs like LIHEAP that help our low-income families keep their homes cool during dangerous heat waves. Environmental health funding is being slashed when we need it most. And scientists, the very people who should be guiding this response, are being pushed out of the EPA. As a nurse, I care for people whose symptoms do not always come with a clear diagnosis. Dizziness, shortness of breath, exhaustion. It's not always that simple. It's the air, it's the heat, and it's the trauma of living through disaster after disaster. My family includes nurses across Arizona, Wisconsin, Tennessee, and Texas. We're all seeing it. Different states, different symptoms, kind of similar, but we're also seeing the same exact story. We're managing chronic illness in unstable environments. We're trying to help people when their homes are not safe, their air is not clean, and then their futures feel completely uncertain. And as a mother, I'm not just thinking about my patients. I'm thinking about my children. about the world they're growing up in, about whether they're going to see real leadership or just more thoughts and prayers while our politicians sit comfortably on Capitol Hill. They're far from our emergency rooms, they're far from our clinics, and they're far from shelters where nurses, doctors, and frontline staff are doing everything we can to provide real answers and not just talk. Nurses do not wait for perfect conditions. We act, we adapt, and we lead. I am asking Congress to do the same. Listen to us, nurses, doctors, scientists. We know what's happening, and we can help with real solutions. Please act like the future depends on it, because it absolutely does. Thank you. And I have the pleasure of welcoming up Ms. Dina Johnson from the Strategic Movement Collective. Thank you.
All right. Good afternoon, everyone. I am Dana Johnson, have the great fortune of being able to serve as an environmental justice advocate, and wanted to, as was mentioned earlier, bring Chicago into the conversation that we're having today. I'm a native Chicagoan, born and raised, and been in Washington, D.C. Whoop, whoop. For about 9 years now. But the intersection of climate change, extreme heat, and public health isn't a hypothetical. It isn't something that is new to the city. I had the unfortunate experience of living through it. This year, we are commemorating the 30th anniversary of, within a 5-day period, more than 700 people dying from extreme heat illnesses. Public health officials in the city actually thought that number was lower. They thought it might be 250 more people who died from extreme heat. But the experience of, in a 5-day period, having coolers set up outside of public health facilities to accept bodies of people who were dying, having elderly, low-resourced Black and brown people who lived on the south and west sides of the city of Chicago is an experience that I would not wish on anyone. And so this past week, I was back in Chicago again. I have 2 parents who are in their late 70s, who have experienced hard-fought battles with cancer. For my mother, unfortunately, that cancer has returned, and she is someone who worked, so she is a taxpayer. She has paid into a system where she receives health benefits, where she also receives LIHEAP benefits. And she is living right now in a senior building, so a brick building in Chicago that frankly is hot as hell, even when it's not that hot outside. So imagine what that experience is like when it is summertime in Chicago. And it's beautiful in Chicago, and we have the wonderful lake breeze, but when it gets to be 90 degrees outside, you feel it. And you feel it especially if you are in a building that is old and that is brick. And she recently shared with me that the LIHEAP resources that she received is coming to an end. And it has been a benefit to her because, as I mentioned, her cancer has returned. But she is also, this is doing her best to pay her fair share, right? And so she shared with me that she was trying to pay the extra bills that Medicare did not cover. And if you are on a fixed income, trying to pay health bills and trying to pay utility bills that people have consistently shared with us today are rising, you find yourself in a fix. And so what we see happening in Congress right now feels extremely personal to me. It's personal to me for my parents. And we asked my mom to come out here today, and she didn't want to because she was contending with the impacts of the cancer on her body, but what the Trump administration is doing by cutting the staff of that program, when we see members of Congress rejoice in taking safety nets and protections away from Americans who have invested in them, who have invested in this country, it is, I don't even know what to call it. The crime and the shame is what came to mind, frankly. And when I think about my mother's economic situation, like, she is my mother. My husband and I and my brother, we will take care of her. But it is a prime example of cutting resources for one set of folks will impact an entire household, an entire family, a community, a city, a state, this nation. It will trickle down because now you have us thinking about and figuring out how we can fill that gap. And there will be children of elderly parents across this country thinking about how we can fill the gap that this administration and this Congress is creating for our parents. And so I'm grateful for people like Senator Markey and Rep. Barragan and others who stand up and fight back for people like my mother. They are offering much needed light in very dark times. And we may not have ideal conditions, the perfect conditions right now to have LIHEAP funding restored and to have staff restored. But we keep casting the vision for what we want for this country, what we want for our people. And that's what today is about. And that's what this coalition of advocates who have come here today is about. And so climate and health are intricately related. It's impossible for us to talk about one without the other. It's time for our government to recognize this and to take the necessary steps to address it. Failure means that all of us, but especially our most vulnerable, will pay the price. And so, thank you. Thank you to everyone who came out today. Thank you for members of Congress for standing with us. And thank you to media who has listened to our stories. And if there are any questions, we open up the opportunity now for you to ask them. We look like familiar faces out here, so there may not be any questions. And
does anybody know, like, is LIHEAP just being eliminated or cut? Like, how much is it being cut?
so here's the thing: when you cut the staff, when you remove the people who are responsible for administering that program, then you cut the program. Sure. There's no way to make it happen. And so I'm going to apologize. I don't know numbers. I do know anecdotally that that program was not even funded at the level of support that is needed. But I will defer to any of my other colleagues standing here so that they can quantify it for you.
No, I was just going to say, hi, thank you for the question. No, I was just going to say there was about $300 and something million of LIHEAP to be distributed already this year. But since there's no staff, as we've been saying, to administer it, they can't get it out. So, and then in the appropriations process, then we are trying to get more funding restored. Here in DC, the LIHEAP ran out in March already, in March of 2025. You can reapply again in October. So guess what happens between March and October? That's what we have now. So that's one example.
I have a question. I know you all are going on the Hill and talking to champions about this, but how can we get more of our elected officials to pay attention to this and to lift this conversation up?
Really good question. I would say these stories, these real lived experiences that we all are living among ourselves and are hearing among our constituents, our networks, our communities, the community members that can't stand up here today and be here to talk to their elected officials here, at least in DC, but certainly can be talking in their home offices if it's possible. We need to continue to not let this go to the wayside. We need to make sure every single story, every single experience, some of the hardest questions or discussions I've ever gotten in 25 years of this work is a parent, a healthcare provider, a grandparent calling up and feeling the burden of guilt because they feel they have not done enough when their child, their grandchild, the child in their care is now in harm's way. They are very angry, they're very frustrated. There are a lot of assumptions that protections are being made and provisions are being made for families for now and into the future that we know are not. And as have been discussed today, the specific strategies and tactics, whether it's reducing funding, eliminating funding, reducing a staff, these are all strategies to make certain programs inoperable and therefore cannot do what the service was intended, which is to protect human health and well-being. So my suggestion would be we have to, again, we've been saying this, let's say it again, we cannot let our experiences, the lived experiences of people that are happening today, a lot of people are not still understanding these connections. Many of us walk in these circles all day long. Sometimes the average person out here still is not understanding how what is happening in our climate is a direct impact of what we are or are not doing related to our connection with our environment, our air, our water, our food system and all these things. These stories are there. They need to continue to be shouted out and lifted up, ideally from the communities that are suffering the most. But in lieu of that, those of us who are championing and trying to serve as voices for those communities need to continue to beat these realities among those legislators and those elected officials that can and need to step up.
Thanks, Nsé. I just wanted to add to those remarks and say that Senator Markey was very humble in his remarks, but he has 4 bills that have been rolled out in July itself that attempt to address how climate change and public health are interconnected. And I believe in one of them, there is bipartisan support from Senator Murkowski, and anyone from the Markey team can correct me. But that's a senator from Alaska. And so clearly, there is an effect on extreme heat in places that are not very obvious to us when it comes to who is suffering from this and how. And so I think that bipartisan action is a really good first step. I'll also say, I'll put in another plug for what our coalition's up to. We decided to come together as environmental experts and public health experts because we were seeing that gap within coalition spaces. Everyone you see behind me has been doing this work for decades. And so the fact that you're seeing them only here today on bridging this issue together means we have to be paying more attention to these experts and bringing them to Congress as much as we can and making sure that they're heard. And if we can't get some of our colleagues across the Hill on the environmental or humanity aspect of the connection between climate change and health, we have to get them on the economics. And we've already proved that not only are they bleeding money state by state, district by district, by not cleaning up facilities, taking care of increased hospitalizations, but they'll see that the energy revolution that they're looking for starts with programs like LIHEAP.